Hello, it's my pleasure to tell you about the initiatives that I've been involved in over the past 20 years at the University of Pennsylvania in terms of encouraging family content throughout the curriculum. I've tried to encourage family content throughout the undergraduate, master's, doctoral, and postdoctoral levels. Starting on the undergraduate level, I've taught in a cancer case study in which we look at individual and family models of illness in terms of the cancer experience, and encourage students to interview patients and their families regarding their model of illness. That is, what does illness mean to me? What does it mean to my family? What's cancer called in my family, and what do I call cancer? How do I best think it should be treated, and how does my family think it should best be treated? And hopefully then helping them learn to listen to patients' narratives and learn how important they are to understanding their world and making sense of their world. On the master's level, I've been teaching for many years in our master's programs. And in particular, I started the pediatric acute chronic program, in which now the name is very much focused on the acute care aspects. But in our program, we still spend 2 of our 5 semesters in the community in terms of immersion experiences, not only with families, but with community agencies and community resources, in which students are expected to take a leadership role within those organizations. In terms of family experiences in this program, beyond the routine clinical experiences that they might have with their clinical preceptors in the acute care or outpatient areas, dealing with patients with a variety of kinds of chronic illnesses, we also have what's called the family experience. And in that experience, we expect them to take a role-neutral approach. And what do I mean by that? In that approach, we expect them to go and learn from the family and have the family be their teacher. So they're not ministering to the patients or the families, we're asking them to learn from the patients and their families, which is quite a different role for them to take because most of them come to us as experienced staff nurses. So throughout these and other experiences, we hope to help the student understand that being a patient in a hospital is really such an inconsequential part of most people's lives, one they hope to forget and move on to the next part of their lives. But we have to remember their families and their communities as the most important context for planning how we care for them and how we advise them to care for themselves upon discharge. On the next level, I teach on the doctoral level. And with doctoral students, I do teach qualitative methods, which I have really embraced for many, many years in terms of their participatory nature, and then being a perfect partner for doing family-related research. So with these methods, I've learned to teach families and students more about themselves. Most importantly, in the doctoral program, I teach a course called Families and Research. And in this course, what we try to do is we try to impart those special issues that arise when doing research with families, and those special ethical and considerations that do arise when working with families. Because I believe that more people would be comfortable doing family research if they really understand the nuances of doing so. So we cover both quantitative and qualitative methods, as well as mixed methods for doing family research. Students get to know family researchers who, in our community and our adjunct faculty, can be role models to them in their careers of doing research related to families and related to individuals, and understanding what the differences are. And finally, I'm involved with postdoctoral research. And in that role, I'm really involved in two different levels. First, I'm involved with our training program, which happens to be both pre-doctoral and postdoctoral, which has been funded by the federal government for over 15 years. And in that program, of course, we invite pre-doctoral and postdoctoral fellows to work with us for a 2-year period of time. That program is really been based on vulnerable infants, children, and their families, and has evolved over the years to include many more nuances of those sorts of that kind of research. And we've involved many other faculty, but it's been very, very heartwarming to me over the years to see the many students who have been interested and involved with families and their communities, as well as with vulnerable individuals. And finally, what I've been involved with in terms of postdoctoral research, postdoctoral training rather, related to family, are really those students that come to us for short-term learning. For a period of about 10 years, we had a learning called the Summer Nursing Research Institute, where postdoctoral fellows came to us for a 2-week period of time for really an alternative sort of postdoctoral experience for those individuals who were not able to take 2 years of their lives and go to a different institution to do so. So they learned from us about the rudiments of being a scholarly faculty member and building their programs of research. Most recently, we changed the format of that program because of constraints, of course, in our system, because of monetary considerations and those sorts of things. We've changed it to a 1-week period that's much more focused on participatory community research, which I believe is really meeting the needs of a group of not only postdoctoral fellows, but also pre-doctoral fellows. We find now that individuals like short-term learning about focal areas. And so I'm able to bring my family research skills to the table there in terms of my teaching. All in all, it's been a wonderful experience teaching about families. I guess I get emotional about it because I really feel it's the heart of nursing. Thank you.